Welcome. Today is an update on cannabis. My name is Dr. Corey Richardson. I am the Clinical Director of Integrated Care of Greater Hickory and the ICGH treatment programs. My doctorate is Applied Health Science Research and Education through A.T. Still University, and I am a licensed clinical addiction specialist and certified clinical supervisor. Today's talk is a little bit longer than normal. We do cover the gamut when it comes to marijuana as a plant, how it was used as medicine in ancient times, and even early American history. We will talk about how it became illegal, and then how it became legal through medical marijuana legislation, and then later on through recreational use legislation. And then finally, we'll talk about some of the newer research that's coming out of these states that have legalized marijuana. And hopefully that'll help you as an individual in the community, clinician, or just general information overall about marijuana to dispel some of the misinformation that's out there. So let's get started. And so cannabis has two species. One is hemp, contains about 20% CBD and about 0.3% THC. And then marijuana, which is about 10% CBD with more than 20% THC. There are several subspecies, but mostly we'll be looking at sativa. That's the subspecies of marijuana that has been studied and used mostly in North America. Cannabis sativa is a plant, has 484 known biological compounds. The flower, seeds, leaves, stems are all consumed in various ways like smoking, vaporization, concentrated oils, infused teas. Edible whole plant is usually cooked into foods. At least 104 brain-active cannabinoids exist in cannabis sativa. They include THC, CBD, CBN, and many others with unclear or unknown effects. THC, this is the chemical structure, and it's the primary psychoactive ingredient in cannabis sativa. So you can see here, THC mimics the body's own neurotransmitter called anandamide that is in the brain's endocannabinoid system. The chemical structure is very similar, and THC binds to that receptor site. It has that effect within the brain. And here is the endocannabinoid system throughout the body. CB1 and CB2, these are different receptor sites throughout the entire body that can be affected because the THC does mimic the body's own neurotransmitters. Cannabinoid receptors are located throughout the brain, and they regulate a host of brain activity like brain development, memory and cognition, motivational systems and reward, appetite, immunologic functions, reproduction, movement and coordination, as well as pain regulation and analgesia. And that's within these receptor sites. So you can see why an outside brain, as all drugs do, they bind to receptor sites that are naturally in the brain, where our own body has some similar function. And so marijuana has been used as medicine throughout history. It was used in ancient China, Egypt, India, and Greece, and the Middle East. And different things from hemorrhoids to digestive problems, even for tapeworms or nosebleeds. And so just because it was called medicine doesn't mean that it was actually affecting any change that was needed. In Western medicine, we've seen it used for muscle spasms or stomach cramps. But America, these patent medicines with cannabis were sold. And they claim to do various things. Keep in mind these old school patent medicines, people were selling heroin, morphine, cocaine as medicine, and gave all sorts of different properties that would take care of ailments. We often call those snake oil. In modern times, advocates support the use for many different symptoms. And that's really what's been pushing the legalization of medical marijuana in some states that open the door for recreational marijuana. I just want to show you a couple interesting pictorials. When man uses drugs, he has a certain affiliation for, affinity for. There's some really interesting pictorials that go all the way back to the ancient times around marijuana. And you could find those same types of pictorials around poppy seeds and opium and alcohol. So here are some of those patent medicines we like to call snake oil, even the Indian cannabis, Native American and people immigrating from South America sometimes brought cannabis with them. And these extracts, and you can see they were using different types of subspecies as well. But they were promoted by doctors and sold, and back then it was less regulated what we could call a doctor and what we could call medicine. But they did have an influence on its legitimacy. In modern times, we have edibles, we have plant put into very legitimate looking pill bottles, and we even have these unusual looking concentrations of oil. And we'll talk a lot more about all this today. The criminalization of marijuana took place early in the 1900s. There was a presumed prejudice against Mexican immigrants who brought marijuana into society, and so there were some legal sanctions in certain municipalities surrounding the use of marijuana. Later on, the federal government created the Marijuana Tax Act, which made essentially illegal, despite some objections from the AMA and other medical groups that proposed use of these patent medications. And in 1971, the FDA did place marijuana on the Schedule 1 status, which means there's no acceptable medical use and a high abuse potential. In 1996, the pendulum started to swing back the other way, beginning in California with legislative initiatives to legalize the medical use of marijuana. And despite these state laws, the Schedule 1 status still is in place. So just to reiterate, while states have allowed the use of marijuana, it is federally illegal. The federal law does supersede state law. The federal government has decided to look the other way while states legalize marijuana in various ways. But it still is still very prohibitive to do research because most of the research in America is done at the federal level with federal funds. So the CDC and NIDA, DHSc kinds of organizations, they're the ones that fund these large studies. And so studies have had to be produced at the state level after legalization in those states. So that has been a challenge to find good research, but some research we'll be reviewing today comes from legalized states. Let's look at the legality of full THC cannabis throughout the United States. The blue states are legal for recreational use in various ways. Either they're being purchased or you can grow a small portion yourself. Green, legal for medical use. Gray is still illegal in those states, but the little red D means it's decriminalized. We don't want to arrest people and put them in jail for marijuana, but we do want them to get treatment. So in various ways, we're decriminalizing it, but it's still not legal in many states. Let's keep three separate issues separate. Sometimes they're conflated as just one issue. Penalizing drug users and decriminalization. It's not just lock everybody up or legalize it all the way. There are three separate issues. You can you can decriminalize it and encourage people to go into treatment. You can look at medical use of the compounds derived from marijuana. So you can create medicine from marijuana. Or you can look at legalization for non-medical use, recreational use, just like you would alcohol or nicotine. Keeping those three separate, we'll move forward. The Institutes of Medicine gave a report in 2003, and it said simply it's to study marijuana as a medicine, to study the consumption of this plant as a medicine is stupid and unscientific. Why would they make such a dramatic statement? Well, one of the things to think about is that there are over 400 different compounds and 70 distinct cannabinoids inside sativa, inside the plant marijuana. And so when you think about this, when I have a sore throat, I don't go to this loaf of moldy bread and eat it because I have a sore throat. We do know that penicillin can be extracted from moldy bread. We do know that penicillin revolutionized medicine, specifically infectious diseases, and the creation of antibiotics and antivirals. So it changed the way we look at medicine. But we don't eat moldy bread. We just know that that you can extract something from it. So the idea to study marijuana as a medicine means that there may be compounds, different compounds that we can extract and look at, different active ingredients that you can look at and study that. But marijuana is an up or down or all arounder. It has all these different compounds, all these different psychoactive, we don't even know all the different psychoactive compounds. And so how can you just give the plant and think it's going to have a specific outcome and know why? And we'll talk more to this as we go forward today. The JAMA review of cannabinoids for medical use in 2015, and we're going to finish up talking about medical use right now. But there was some quality of evidence to support cannabinoid use with chronic pain and spasticity, but very moderate. Very low quality of evidence for chemo-induced nausea and vomiting, HIV-related wasting, sleep disorders, and Tourette's. So, and significant adverse effects that were reported during these studies when they reviewed various research reports. But this is using the medicine, marijuana as a medicine. A lot of conversation is about cannabinoids and how they affect pain. And so since we've talked about pain so much and in juxtaposed to opioids, I would like to take a special moment to kind of look at that today. Cells are injured in tissue. They release what we call endocannabinoids. And we talked about that earlier about anandamide, the neurotransmitter that our body naturally creates in this endocannabinoid system. It affects CB1 and CB2 in the brain, spinal cord, and it has an effect on inflammation. It reduces inflammation and reduces hyperalgesia. But this is our body's natural endocannabinoid system. And we don't know that smoking marijuana reproduces that. We do know that THC looks a lot like one of those neurotransmitters. So whole body exposure to exogenous cannabinoids, meaning smoking marijuana or consuming marijuana, we don't know that that really does result in inhibiting pain. We don't have the long-term studies matching exogenous cannabinoids to pain reduction. And one of the challenges we have with a lot of these studies is it's a subjective report. And so when you're looking at drugs that have addictive properties like alcohol, nicotine, and opioids, and other drugs that have addictive properties, there is a lot of caution about the trustworthiness, the objectivity of a subjective report for pain improvement around a drug. So somebody who's smoking marijuana, can we trust what they say about reduction of pain? It's an addictive property. Sometimes they cannot be objective about that. Some compounds of marijuana have been demonstrated to have some medicinal qualities, and the FDA has approved one of those called Marinol for very specific chemotherapy-induced nausea and vomiting. We do know that there are far more superior non-marijuana drugs on the market today. CBD, we're seeing more and more use of that in America today, the natural CBD purified from the plant. The FDA and the DEA have allowed some research into other marijuana-based medications, so something that's extracted from marijuana and studied. Marinol is approved for use. Sesamet is another drug that's approved for chemotherapy-induced nausea and vomiting. And Sativex has not yet been approved in America, but it is being studied not just CINV, but also MS and cancer pain. But it is approved in Canada and Europe. There are going to be some recommendations for physicians in those states that allow legal marijuana, and these need to be followed pretty stringently. There needs to be a prior relationship between the patient and the physician prior to providing this recommendation. There needs to be a documented in-person medical evaluation. The physician should discuss the risk to benefits. Also needs to discuss the real variability and lack of standardization of marijuana preparations. Labels on marijuana products do not match what the content is. Patients need to also be warned not to drive or operate heavy machinery. There needs to be a written treatment plan that will not exceed 12 months, and the treatment plan must specify the qualifying condition that's being treated. It should also demonstrate clearly efficacy of the drug, the goals for the treatment plan, progress toward these goals. We should make sure that this individual isn't getting marijuana or other drugs that may complicate the medical progress. They look at the state's registry to look at that. You don't want to use other drugs along with this one. It may have some complicating problems if you use other mind-altering drugs. If there is a suspected SUD or any other psychiatric disorder, you do need to have some expert consultation to see if marijuana would challenge the treatment outcomes for these other diagnoses. You need to have complete medical records. I think very importantly, states have said physicians cannot have a financial interest in marijuana whatsoever, in any way whatsoever, and that physicians and others who prescribe medical marijuana should not be using medical marijuana or recreational marijuana themselves while they engage in the practice of medicine. Are we repeating history? People are always telling me that it's being prescribed in Colorado. It's legal in Colorado. So sometimes doctors have made errors, not just the patent medicines where we're prescribing cocaine, not just leeches historically, but even doctors who said, nicotine isn't such a bad thing, it's good for the lungs. I think sometimes even the medical community and many state legislators are being influenced by commercial as well as tax revenue that might be available. So we start to now that legalization is some decades in, we're starting to now look at the weighing the dangers of cannabis. And so as interest builds in potential health benefits from the plant, prescribing it as medicine, accumulating evidence confirms that taking the drug carries risks. Let's just talk about culturally what we're seeing in these states that have legalized marijuana. There's a real perception that marijuana is medicine now. Look at these very legitimate packaging for marijuana. But we do know that essentially the labels aren't accurate. 83% of the labels have inaccurately looked at the content of THC and CBD. And that means that about 17% are accurate, 23% have been underlabeled, where 60% were overlabeled. And so I think that's a real challenge. You don't know what you're prescribing or giving somebody in the clinical setting if you're going to call marijuana medical. Moving on, advertising and marketing. And it's fascinating that the OxyContin CEOs are starting to jump ship and go over into the medical marijuana boat. We do know that back in the early 2000s and the 90s, we do know that pain was really pushed by these pharmaceutical companies as a symptom that had to be treated aggressively with powerful opiates. We do know that a lot of that prescribing was pushed because of a singular report in JAMA about opioids being safe for the prescription for the treatment of pain, and that pain should be one of the vital signs that's looked at every time a patient is evaluated. And that has really dug this huge opioid crisis that we are still trying to dig our way out of. Over 90,000 people within the last 12 months have died just of overdoses alone. And so I think that's real telling when we look at this next problem that we're getting involved with, which is the cannabis problem. So marijuana is big business. You can't deny it. There's a lot of revenue, that's a lot of profits that are being brought in by these states that have legalized it. I'm going to give you a lot of visuals right now just to kind of give you the culture of these legalized states. You can open up any little magazine and here's some cute cartoon characters with some coupons. You get free lighters and it's 20% off, and you can always stay high. But they're not just smoking joints like they did back in the 60s. THC now is available in electronic forms and all sorts of innovative delivery systems that have really high concentrations of THC. So many people that look down on smoking any product whatsoever, especially the culture of the hippie or whatever, and the joint or the bong, that now you don't have to do any of that. You can still get concentrations of THC through edibles and other products. Let's look about edibles a little bit before we show you the pictorials. A delay in effect encourages additional consumption. You'll eat something, you'll feel nothing. You'll eat some more, feel nothing. And then all of a sudden it'll hit you. This additional consumption prior to feeling it has put a lot of children and young adults in the ER. And THC does metabolize into 11-hydroxy-THC in the gut, which is different than smoking it or consuming it in other ways in the gut. This is much more psychoactive and has a much greater impact on mental health outcomes for those who are affected. So look at these fun, colorful products that are really attractive to kids but have cannabis, THC in them. You can see where a child would be very attracted to these products. You can see where an adult who didn't want to smoke could still get THC through potato chips and drinks and all sorts of other cool, hip products. Here are those candies and gummy bears and cotton candy. And I'll tell you, if I had a child around, I would be very scared to have any of these products anywhere nearby. I'm obviously not a proponent of marijuana, but This has been a real problem in these states that have legalized marijuana. Again, more of these colorful candy products. But let's look at teen use today and how they're attracting the new cannabis users through sex appeal. Some people who would never dream about getting stoned and smoking in a bong, now they have all these other products and it seems hip and cool and very LA. Youth, look how hip. You're not sure what they're selling if you didn't know what cannabis was. You know, they've got this really hip, cool billboard that can be seen by anybody walking by or driving by. It also looks very legitimate. Older users who would never dream about smoking marijuana now can look at it for some of their ailments, quote unquote. And now the constant thing I hear is marijuana is safer than, marijuana rather than. But what we're seeing is just the opposite. It's always marijuana with. And this is literally weed infused wine. This is weed infused or THC infused alcohol, beer. And there's big profits involved. There's potentiating between using drugs together. And it's not rather than, it's always with. We're seeing that's the take-home message. It's always with other drugs. And this is not the marijuana of the 1960s with a 3% concentration. This is a marijuana that decade after decade has very high concentrations. And we're talking about 98% THC, 98% in this earwax or this hash oil or these capsules. And this is how children are ending up in the ER, or young adults are ending up in the ER. We'll talk a little bit later how over 15% THC concentration, even in a city as permissive as Amsterdam, that city is looking at anything above 15% will be listed as a hard drug, just like heroin is a hard drug. A blowtorch to get higher concentrations of this drug. All these new oils and products are very easy to take with you when you go out. And of course, we know driving and heavy machinery is a problem on these products. Biggest challenge that we're going to be talking about is obviously the youth. So many times when states were being marketed, legalized marijuana, it was reported that there will be no increased use, that we're just going to keep adults out of jail. The adults are going to be using marijuana. This is not for children. This is not for young adults. They're not going to be using it. We're going to legalize it. We're going to regulate it. We're going to control it. And just the opposite of all of that has happened. And I'll show you exactly how. Youth use has increased in every state that has legalized marijuana. Stigma has gone down. Perception of harm has gone down. And use has gone up. And use across the country now has gone up because some states are legalizing it, and stigma across the country is going down. Perception of harm is going down across the country. So use has increased just between 2002 and 2016 by 64%. But also look at daily use and also heavy use. So 42% of current users are daily or almost daily users. And this is, again, higher and higher concentrations of THC than we've ever seen before. So Colorado now is #1 in U.S. for first-time users, and marijuana use continues to rise in states that have legalized it. The challenge that we're seeing now in these legalized states is cannabis use disorder, a real diagnosis of problems, harmful outcomes, use of marijuana so that they're not doing all the other things they're not achieving in school. They're not going to these recreational activities. They're harming other types of aspects of their lives, and they're continuing to use anyway. They cannot reduce their use or quit using. So we're seeing that with our youth in these states that have legalized marijuana. This is part of the problem. We know that vaping and nicotine is a big part of the problem. Smoking was on the decrease for years, and these brand new products to deliver nicotine came to the surface. Initially, most states allowed these flavors and cartoon ads and all these things to get youth addicted. And now we have a whole generation of high school kids vaping. These vape machines are also delivering high concentrations of marijuana, up to 80% concentration of marijuana. And So the jewel pods that contain literally 3 times the legal limit of nicotine in the EU, and their sales are currently banned in the EU, but we allow them here, high levels of nicotine. And these same products are delivering this very potent THC that I said earlier has been classified as a hard drug in even Amsterdam. But in the United States, there's no cap on potency, none whatsoever. The marketing for these products is very open to this young, hip population, and you see some of the stuff from Comic-Con, and as you saw earlier, there's some sex appeal and hip appeal and all these other types of things to promote its legitimacy and attractiveness. But the Truth Initiative has done some real research, and they're challenging marijuana just like they did with nicotine. It had a huge impact on nicotine. But we do see that 1 in 3 teens has tried marijuana by the 12th grade nationally. We do know that the young e-cigarette users are 3.5 more times likely to use marijuana. I think that's very disturbing because this is the population most harmed by marijuana and has a long-term effect from marijuana. And we've seen that with the developing brain of somebody who starts using earlier and earlier. We will definitely talk to that more in a little bit. Almost 6% of high school seniors are daily users of marijuana across the country. And vaping marijuana has not only been linked to lung illnesses, but also some deaths. The adverse effects back in 2014, New England Journal of Medicine demonstrated that about 9% of marijuana users will become addicted. But if it starts in the teens, that rate goes up to 16%. And if it's daily use, that rate goes all the way up to 25 to 50%. The adverse effects of marijuana are really concentrated for our purposes on the brain development. So the younger and younger people are using, you have worse outcomes when it comes to brain development. Brain isn't fully developed until 21 to 23 or so. And so you're going to see with use in a younger brain impaired connectivity and specific reasons, and that's going to affect self-consciousness and awareness, learning and memory. It's going to have some effect on the prefrontal cortex where we have executive function. And we are demonstrating as an adult, a lot of these users have lower IQ levels. And we're going to see in the same population impaired motor skills when they're driving or using heavy machinery or when they're doing other activities that require motor skills, cognitive impairment, motivational impairment, and there are increased risks associated with the method of consumption. There are going to be special risks for adolescents, like we said, with the impact on brain development and the increased risk of psychotic syndromes, specifically schizophrenia and suicidal ideation. Cannabis users have demonstrated a use is causally related to depression and suicidality. So this study suggests a causal relation between frequent cannabis use and both major depression and suicidal ideation. And so I think this is really important, as this is one of those research studies that came out a couple years ago when we were really looking at the legalization, and people were really angry in the medical community that it wasn't enough research, and people were legalizing, lawmakers were legalizing marijuana without enough research out there. It was almost legalize it and then we'll figure it out. And then this is some of the first things that many of us in the healthcare community were seeing, especially myself when I was doing my PhD and looking at the research. So causal links between cannabis and schizophrenia do exist. This is a European study. You take 2 different populations, and there's a increased risk of schizophrenia in one population. And when you separate that out for those in that increased risk use cannabis and those who don't use, there's a causal link that cannabis increased the rate of the diagnosis of schizophrenia. So I think that's an important issue when we're talking about use in America. We'll look a little bit at what are these psychotic episodes, because it's probably the most important part of a lot of the research because it's about a very specific diagnosis and not just general outcomes. Schizophrenia and other psychotic syndromes, and that's where there's a sudden worsening of psychotic symptoms over a short time, frequently resulting in hospitalization. And so there have been a number of studies just focusing on youth use being entered into hospitalizations with a psychotic episode. And the heaviest users of cannabis are around 4 times as likely to develop schizophrenia than a non-user. And even an average cannabis user is twice as likely to develop a psychotic disorder. And this is a causal relationship. So looking at those people who are similar in every way, including an increased risk or not an increased risk, looking at those users, and then how often do they develop this condition. So at Boston's Children's Hospital, we see 85% of admissions have a diagnosis of a cannabis use disorder or problematic use. That's a co-occurring disorder with children that are being admitted for other things like suicide or depression. So Clement and her colleagues analyzed the findings of about 68 different reviews of cannabis. And of the reviews, 62 showed associations between drug and various negative outcomes, including impaired driving, an increased risk of stroke or testicular cancer, brain changes that could affect learning and memory, and a particularly consistent link between cannabis and mental illness involving psychosis. These risks were highest for teenagers, pregnant women, and people who were already at risk of mental illness. And that's a large review of different studies. It's called what we call meta-analysis, as they identify some similarities between the research. The research now is really becoming clear years and years after legalization. So we often look at Colorado as an example of legalization. While other states were considering legalization, they always talked about Colorado and they kind of pointed to maybe some revenue. But now, decades later, we're seeing some real outcomes. So in 2000, Colorado legalized medical marijuana. And that allowed for some further policy changes in 2009 that made the substance easier to obtain. So between 2008 and 2014, the licenses for medical marijuana went from 5,000 to more than 100,000. The interesting thing is because now there are about 100,000 different medical licenses to obtain marijuana, obtaining it became much more easy than those 100,000 licenses. So in 2012, the state also legalized recreational use, and shops began selling cannabis in 2014. So now recreational use, not so much the medical licenses. And as cannabis has lost its stigma in Colorado, the research shows that there is an increased need for healthcare related to cannabis. So between 2012 and 2014, these cannabis-related visits to emergency departments saw about a 40% increase related to cannabis. And many of those visits were related to mental illness that were diagnosed 5 times more frequently in people who would use cannabis. But it's not just about mental illness, it's also about some accidents. So cannabis is also causing more of the other types of accidents than it used to. So from around 2009 to 2015, one children's hospital of Colorado in Aurora saw 81 children under the age of 10, and they had been accidentally poisoned by cannabis. And the state's Poison Control Center dealt with around 163 children within the same age group with a mean age of only 2 years old. So the rate of marijuana-related visits to children's hospitals nearly doubled during that time. And the number of cases at the Poison Control Center increased by 34%. And that's far outpacing a 19% annual increase for the rest of the country. So legalization does have outcomes that are adverse, specifically within the youth population around accidents. These adverse outcomes do not seem to be abating. Sometimes after legalization, many lawmakers and others will think, well, it's just a period of time. We're going to have this, and then it's going to be normalized. Parents are going to know to keep these types of products away from children, and we're going to do all these other safety things. These accidents have not been abating. They continue to increase. Between 2012 and 2016, there were nearly 10,000 cannabis-related visits to the University of Colorado's ER department. That's just one ER department in the state. And the reasons included psychiatric, cardiovascular, and gastrointestinal. And a lot of these are around these edible products that accounted for about 10% of the visits, while edibles were actually just 0.3% of the sales. There are some long-lasting negative health effects. So these effects may linger even after intoxication has ended. So sometimes when people are talking about cognition and all these others, they say, well, of course, the person's high. No, not at all. So studies vary in the definition of heavy use, but generally we see that people who use cannabis are at least 3 times a week, often every day, and usually for years is defined as heavy use. But that kind of use has been associated with the lower scores on tests of memory, attention, planning, and decision making. So in 2016, a review of around 105 studies occurred. And it was found that after 12 to 24 hours of abstinence, these heavy users still perform worse than non-users and less frequent users on tasks that assess verbal learning and memory. And although several weeks of abstinence can lead to some recovery of cognitive function, these imaging studies that have been done suggest that extensive use is associated with longer lasting changes to the function as well as the structure of the brain. So, for example, studies have measured reduced volume of the hippocampus, which is directly involved with memory in the brain, and that's with these long-term users. Psychosis is, again, another major concern of a long-lasting negative effect, and studies have shown that cannabis can raise the risk of early onset psychotic symptoms in those predisposed to the illness, especially with daily use that is high in THC. Again, Clement and her colleagues found that people who used cannabis frequently or heavily had a higher risk of developing schizophrenia and psychotic symptoms than did people who never used. And it has been shown with many of these studies that there's a causal role. Long-lasting negative health effects. Here's a study that was done with 900 people internationally across Europe and Brazil, and they visited 11 different psychiatric service sites for their first episode of psychosis. So with data from many people over multiple sites where availability of the high potency strains varied, the study showed that there was a strong association between daily cannabis use and the likelihood of developing a psychotic disorder. For those who used particularly potent high THC strains, the risk was fivefold greater. Assuming a causal connection, the researchers did estimate that eliminating the availability of just the high potency cannabis would prevent 12% of the cases of first episode psychosis. Long-lasting negative effects really do affect the brain's reward center, as it is a prime target of the long-term effects. Imaging studies show downregulation of our own natural cannabinoid receptor system, our endocannabinoid system, in heavy users. And this suggests that chronic use might often make people less motivated to seek out other typically rewarding and often important experiences, such as social interactions. And the behavioral studies, the social studies that we have done prove that out. It kind of matches with what we've done scientifically in the research community, medical research community. And so users might also need more cannabis over time to achieve the same result. And increasingly, it seems that there are certain genetic factors that make some people more susceptible to these changes, which would lead to addiction. We describe addiction or define it as cannabis use disorder. We'll define in just a second. But there are those who are predisposed to addiction, and when they use cannabis, that may become their primary drug. As many as 30% of people who use cannabis will develop symptoms that are consistent with addiction. And this is from the DSM-5, and it's been paraphrased somewhat, but persons with a cannabis use disorder develop cravings when they don't have the drug. They develop relationships. They damage their relationships or give up other activities they once enjoyed so they continue to use the drug. They struggle to stop or reduce use, and they do experience withdrawal symptoms. Studies are somewhat mixed about the prevalence of cannabis use disorder and whether it's becoming more common. We do see that it has become more common in states that have legalized marijuana, but cannabis has become more readily available, so that is one concern that more people may be at risk of developing an addiction will try it. It is important to make sure that people realize that cannabis has a risk potential for addiction. And as we demonstrated earlier use of a higher concentration do affect rates of addiction in one study. Specifically with youth, we have developing brains of teenagers which seem especially vulnerable to cannabis's long-term effects. Let me just go through this pretty clearly. People who start using cannabis regularly and heavily before the age of 16 might end up using it more frequently and consuming it more as adults. So 16, that youth use, seem to have a greater rate of use later in life and greater consequences, negative consequences. When compared to non-users and people who start after age 16, those who use cannabis before that age make more errors on tests that assess executive function, And that's that set of skills involved with planning and decision making, and it comes from affecting the prefrontal cortex. So early use seems to affect the organization of white brain matter, which facilitates communication between different areas of the brain. And these changes are related to higher levels of impulsivity, but only in users who start earlier. So starting young may accelerate memory loss. And here's one interesting part of one research study. Data suggested from that study that adolescents who use cannabis a few times a week for 2 to 3 years develop memory impairments that are similar to those reported in adult users who started in young adulthood who've been consuming the drug regularly for at least 20 years. So there's some really accelerated negative effects when we talk about youth use. And here is an interesting slide to demonstrate use as compared to perceived risk. Now you will notice that in 1975 the past use was high when the perceived risk was low, keeping in mind that the concentration of THC in marijuana at the time was very low, without any of these other delivery products that we have now that deliver very high concentrations of THC. So you're comparing a 5% to a 98% product. We do see in the late 80s and early 90s an increased perception of risk as the concentrations are starting to continue to grow. But there was also some real prevention messaging that was going on at that time, and use did fall. At this time, you see the switch, and once again, the perceived risk is falling. Unfortunately, we're demonstrating at this time with these high concentrations of THC and these adverse outcomes in these legalized states. Unfortunately, risk is actually increasing, and not just the perception of risk. And then use, unfortunately, is going up in these states. So, in 1993, with relation to U.S. teens, around 26% reported use, but 36% believed it was harmful. Today, that is inverted, with around 36% using regularly in our U.S. teen population, and only 20% of U.S. teens believe that marijuana is harmful. So here's looking at some data and it's called Monitoring the Future data. In 2018, 1 in 4 12th graders would try marijuana or increase their current use of the drug if marijuana were legalized. That's a 12th grade population, okay, that should not be using marijuana. If it were legalized, use would start or increase. So this contradicts a lot of states that are saying marijuana legalization does not affect use. Dr. Volkow from the National Institutes on Drug Abuse, she had a report in the New England Journal of Medicine specifically targeting legalization. Repeated marijuana use during adolescence may result in long-lasting brain function, changes in brain function that can jeopardize educational, professional, and social achievements. She went on to say that, however, the effects of a drug, either legal or illegal, on individual health are determined not only by the pharmacological properties of that drug, but also by its availability and social acceptability, legalization, and perception of harm. The idea of stigma. So in this respect, legal drugs like alcohol and tobacco offer a certain perspective, accounting for the greatest burden of disease associated with drugs, and it's not because they are more dangerous than illegal drugs. We have some very dangerous drugs today in our communities that will cause immediate, harmful, negative outcomes, like norfentanyl and heroin and other types of illegal drugs in the community. These are safer drugs, but they're legal, but they have a greater public health cost because they are now because of their legal status. So it's all about legal status and exposure, especially in our youth. Here's a great book if you're interested about some good reading. The Truth About Marijuana, Mental Illness, and Violence. I was able to review some of this book for this webinar today. And one of the interesting findings I did look at in the general workforce, the marijuana positivity increased 4% from last year throughout the country. You can see some states here and they're increasing positivity, but there's a sharper increase in positivity in the safety sensitive workforce. We do know that marijuana's effects are long-lasting, and specifically with persons who operate heavy machinery, uh, that is a huge impact on motor vehicle accidents and other workplace accidents and productivity. The marijuana industry has promoted some advertising around legalization because it's safe, it's helpful for our community, that somehow there's a substitution phenomenon between marijuana and opiates. And they even pulled a JAMA article from 2014 and misinterpreted it for this billboard. Sometimes you can compare apples and oranges. It's kind of like saying states with ice cream eaters had 25% more drowning deaths. Sometimes you're comparing things that don't need to be compared. But I did want to look at this 2014 JAMA study that some of these proponents of marijuana legalization are using, because something doesn't add up around that study and around subsequent studies. If you looked at the raw data that showed medical marijuana states, they actually had higher rates of opioid deaths until the authors started to introduce other possible reasons why there were higher deaths. And so the study did lump together these highly restrictive states with these highly permissive states, and you really can't do that when you're looking at medical marijuana. And it also ignored something that's very powerful with opioid overdose deaths. Opioid deaths have a sharp turn. They improve much more in states that use an expanded medication-assisted treatment program or have rescue Narcan in their states. And so if you left out the states that allowed and didn't allow for MAT or naltrexone, you really, or naloxone, you really do have a challenge there with trying to determine that was marijuana the reason for any of the changes, or were there other explanations like MAT and rescue Narcan and even naltrexone? Were they part of that dialogue that should have been there? Subsequent to that JAMA study, it was found that this correlation, when it was reviewed in the book that I just showed you, the correlation really does disappear after 2010. So you need to look at 2010 forward to look at really what's happening in our states today around marijuana versus opioid. And the Journal of Opioid Management tried to replicate that study, and it found that actually medical marijuana laws were associated with a 22% increase in age-adjusted opioid mortality. So opioid mortality increased with medical marijuana laws when that study was replicated. So maybe it was a flawed single study that's being touted by commercial entities and others to promote marijuana use throughout the country. In February of 2018, even an editorial in Addiction Medicine did show a very weak connection between those two. Some of the Lancet conclusions were there was no evidence that cannabis use improved patient outcomes. Those who used cannabis actually had greater pain and a lower self-efficacy in managing pain. So outcomes with pain management were actually worse with cannabis. And this is all medical marijuana studies. These are all studies that looked at medical marijuana. And no evidence of cannabis use reduced pain interference or exerted an opioid sparing effect. There was no evidence that there was less opioids used. Actually, the opposite is being found. Medical marijuana users in this Journal of Addiction Medicine study in 2018 these users were actually more likely to use prescription drugs or medically and non-medically, meaning that they are getting a hold of opiates, either prescription or non-prescription opiates. So the findings of this study disconfirm this hypothesis that somehow that at a population level, negative correlation between medical marijuana and prescription opiates. It's actually quite the opposite. Medical marijuana users should be a target from this population for non-medical prescription use or prescription misuse. Here again, you're looking at marijuana use. It goes hand in hand with an increased prescription of opioids. The control group of opioid, no marijuana use. An opioid use disorder, and here non-medical opioid use. So the chance of subsequent opioid misuse with marijuana users, it goes up rather than down. 2018 JAMA, the opioid crisis does appear to be worsening where marijuana has been legalized, where some states have had some positive impacts with MAT and rescue Narcan. Across the board, no matter if MAT, rescue Narcan is used or not being used, the opioid crisis is worsening where we have legalized marijuana. National Academies of Science report, cannabis use and misuse of other substances. So cannabis use is actually more likely to increase the development of a substance dependence with a drug other than cannabis. And guess which drug has gone up in Colorado? So we're looking at opioid deaths having increased, not decreased in Colorado since its legalization. You can look at medical marijuana and opioid deaths, commercialized, meaning recreational use of marijuana, increasing again with opioid deaths, and then fully legalized marijuana use. Okay, year after year after year, opioid deaths have increased. Seed to sale. The governments are claiming that they know where every marijuana seed is, but actually it's not happening. A lot of marijuana is missing from these dispensaries and it's getting out into the illicit market. So legalization was alleging that they would regulate and control and tax and it would be safe. It's actually just the opposite. We're demonstrating that marijuana is missing from all of these dispensaries and being sold anyway on the illicit market. Another problem is sales to minors from legal dispensaries. And we know this to be true. Marijuana alcohol is sold in our communities. There's always a challenge with minors using it. Sales to minors are continuing, and this is no different when it comes to legal marijuana. And as we have reported again, the huge negative impact on youth using marijuana products, these highly concentrated products. Another challenge, like we were talking about, and this is just some news articles that kind of confirm what we know by our research, is the availability to children, young children, through these edible products. Here's one from Time Magazine. A 9-year-old accidentally shared her grandpa's marijuana gummies with her 5th grade class. And one was arrested when marijuana gummy bears were brought to a Chula Vista school. And then edible marijuana at a Hollywood school sends a 14-year-old to the hospital. So these are just some articles, but they really are just confirming the research that we have gone over earlier today around specifically in Colorado. What about pesticides? So, we talk about so many different things about illicit sales and we talk about, sales to minors and the illicit market. Agricultural production of marijuana has gone up because now it's legal in these states. But what about pesticides? Contaminated marijuana reaching consumers. One lab looked at 41 out of 44 samples. That 93% of those samples tested positive for pesticides, which are getting to the consumer. Surely smoking pesticides and consuming pesticides is not safe for our population, but just like so many other issues, we're not addressing these. In our pregnant population, we know that cannabis use is increasing in our pregnant population, and this was shown in a study in JAMA in 2019, and a Canadian study demonstrated that these babies are more likely to be premature with lower birth weights, being transferred at a higher rate to NICU, and even prior to the delivery room, the placentas are detaching. And so there's some real negative outcomes with our pregnant population, but the perception of risk is decreasing, so use is increasing, even in this population, even daily use. So when we're looking at benefits right here to some possible negative outcomes, keep in mind that the research is kind of covering the gamut. There's some new research that's available now around medical marijuana and recreational marijuana across these states. But it's new research and it's at the state level and it's not large federal studies. So when we look at the National Academies of Science, they do offer some recommendations. And the idea is that we need public agencies to be funding larger studies to look at some of the short and long-term health effects, either positive or negative. And they really do need to be done through these agencies of the DHSc, which is like NIH and CDC, NIDA, and others, to look at the negative and positive outcomes. Despite the increasing popularity of marijuana, please keep in mind that we're talking about high concentrations of THC as opposed to these lower concentrations that were used in the past and that are being used in these studies in these state levels. They're not studying high level use, they're studying low level use. We only look at high level use after the fact when they become negative outcomes for children and those with psychiatric or mental health illness. Marijuana is illegal under our obligations for 3 international treaties. And so that's important, that while we have studied, not only is it federally illegal, it's also illegal internationally. And I do think that illegality is important. The legal status does keep marijuana from being used in those states. So it does lower use in those states. And that should be a key public health strategy, is keeping marijuana. As we have shown today, it is a false dichotomy to think that we have two choices, either full legalization or incarceration. That is not the case. It does not need to be the case. There are different issues there. We can decriminalize without making it legal. If it does not have any strong evidence to support any of the compounds for medical use or the plan for medical use, I think we need to revisit that. And we do need to be honest about the negative outcomes associated with recreational use. Many states were promised large tax revenues with the legalization of marijuana, and this is very disingenuous. None of these revenues ever came forward, and this reminds me of the panacea of revenues that were promised with our lottery systems in our states. When I was young, there was a promise that many states were against gambling, but that's kind of promise that the revenues from the lottery system would allow for a true panacea for our educational system, that the test scores would go up because of these really improved programs, and that just hasn't occurred. But we still are saddled with our lottery system, which really does target our poor and our minorities. Similarly, we have all these promises of tax revenues. Corporations are making money. Predatory doctors are making money by prescribing marijuana for various ailments. But are people getting better? And there are no tax revenues that really can justify the horrible outcomes that these states are experiencing with youth use, with increased hospitalization, and increased diagnoses of some real serious problems with those with mental illness. There are current regulatory failures that I think are complicating this. No potency caps. You could sell marijuana as strong as 99%. There's nothing that is being done to decrease the potency that is being sold. Black markets and cartels are now as involved as ever. Not only are seeds and other marijuana leaving these dispensaries without being tracked and getting onto our illicit markets, many legal packaging is being used with illicit marijuana, and many, of course, illicit marijuana can be adulterated with all sorts of other products like cocaine and benzodiazepines, etc., but being placed into these legal packaging. And the other problem, I think, is in all legalized states, we have seen an increased access and increased use for minors, and those negative outcomes. There's been no real control of pesticides and other contaminants in legally sold marijuana. And finally, pregnant women and others who are higher at risk are continuing to use at greater rates. There are some major gaps in our knowledge, and we're going to close out today with looking at some of these definitive studies that follow people for years is still missing. And there's really no scientific evidence to back up some of the recommendations that are being made by those who propose cannabis legalization, specifically and commercially. Various compounds in cannabis can be seen to interact, and they're changing the effects of cannabis depending on the relative concentration. So I'm kind of ending with something that's different. Some of the one recent randomized controlled study showed that very low doses of CBD enhanced intoxication. And let me reiterate that cannabis with high levels of THC but low levels of CBD exacerbated the cognitive impairment as impairment relative to just THC alone, or THC alongside a large amount of CBD. So there's a lot of things that we should be looking at. Not just that cannabis is much more THC is much more potent in these pharmaceutical and non-pharmaceutical delivery systems, these products, but then it can be compounded and made even more potentiating, whether it's in the gut or with low amounts of CBD. Let's look at some myths that we probably came into this conversation with, or that you hear. Marijuana is a harmless, non-addictive product. Marijuana is proven effective medicine for pain and other types of ailments. Legalizing marijuana will keep people out of jail. And we know that that youth that get a hold of marijuana are still arrested. They may not be jailed in these decriminalized states, but legalizing marijuana has not changed that. That now there's more youth that are apprehended with marijuana or found with marijuana than before. It is people are always saying it's safe to drive or use heavy machinery on marijuana, and that when we legalize it, we get the illicit component out of it. And again, that has just not been the case when it comes to marijuana. We see cartels or others still having a strong impact and even benefiting from these states that have legalized marijuana. Somehow it's safer than alcohol. Alcohol isn't legal because it's safe, but marijuana's effect is much longer. And in states where marijuana is legal, we're now seeing more and more people using marijuana. And in those states, we're seeing far more problems at schoolwork and home. People rarely substitute marijuana for alcohol, they use them together. And that's also complicating a lot of motor vehicle accidents and other accidents as well as workplace injuries. But the use is rising across the board, and so we're going to continue to see more and more problems. I hope this is what you've seen as the truth and is supported by the research today. Marijuana is harmful, and it's 30 times stronger than it ever has been in the past. It has some real negative outcomes. Legalization has had some significant costs throughout the United States, and these states have legalized it with increased hospital visits, poison control center calls, workplace productivity, motor vehicle accidents, pesticide concerns, and other environmental concerns, and even secondhand smoke. But we've covered the gamut with the costs to these states that have legalized marijuana, both medical and recreational. They are very different things, and we do need to study and talk about medical marijuana and recreational marijuana separately. They're not the same issue. And pulling out specific compounds is very different, again, than smoking or using the entire plant as medicine. Across the board, leading public health authorities still oppose legalization for obvious reasons. And legalization will not solve the violence and criminality that's involved with the industry. We have still seen the real criminal element, as well as the other problem with minors getting access, increased access, and using marijuana at greater and greater rates in these states. Marijuana is a mind-altering drug. Drug drivers are killing more people than alcohol last year. The problem, I think, with some of the research is motor vehicle accidents and marijuana lasts longer in the body, has longer effects in the body, is demonstrated to have longer negative cognitive and motor impairment effects. But marijuana is being used with other drugs and not being used by itself in these states that have legalized marijuana. Adolescent brains are being damaged by marijuana, and some of this damage is long-term. Cannabinoid misuse is a growing problem throughout the country, not just now in these legalized states. And a lot of that is about perception of risk and reduced stigma around marijuana use. First-time use in college is as high as it's ever been in 3 decades. Usage has increased in Colorado after legalization, so the claim that legalization wouldn't affect the rate of use is completely not true. And cannabis has been associated with increased suicidal ideation, has been demonstrated to have a causal effect with certain psychotic syndromes, including schizophrenia. And we've really shown that with all. So in conclusion today, I just want to say that users, as well as lawmakers, need to be aware of the risks to be able to make some informed choices. And more research really is needed in this area. I know this has been a much longer webinar than I usually give, and I want to thank you for participating today. I hope it's been informative, and whether it's in your own practice or whether in your own communities, I think that hopefully those states that have not legalized marijuana can look at it, some of the new research that's coming out of these legalized states, and make some informed decisions. And those states that have already legalized marijuana can maybe roll back some of this. Because I think the negative impact on our communities is just starting, and I don't think we have seen the end of it. Again, we have covered the gamut today. This is some of the references that I used to create the webinar. I hope that it's been extremely informative about what marijuana is, what the chemical compounds, historically what was used. If you have any questions specifically about the research or cannabis use disorder, please. So this does conclude our webinar today. I want to give you my contact information for any further questions. feel free to call me, or you can reach me at crichardson@integratedcarehickory.com. Please follow us on Facebook to follow all of our different programs. We do educational programs, outreach programs, community intervention programs we have for many years through Integrated Care of Greater Hickory and our nonprofit Recovery NC. We have various treatment programs from Lincolnton, Statesville, Gastonia, Dobson, and now we're offering services even in Cleveland County. Various grant programs to support free RAP training, free peer support training, free educational programs and prevention programs for our youth throughout school districts. So we have a lot of interesting things coming on, but all these programs together have been able to support all of the webinars that we're able to produce at Integrated Care. And we do appreciate feedback, and we appreciate your support. And thank you again for participating today.